So if we know as many things as we do about fluoride and the potential dangers, I guess the big question is why is it used as much as it is still in countries like the United States?
It's quite a number of communities have stopped doing this. I'm glad to say, many countries in Europe stopped doing it. It's denial. There's no question that the dental lobby, the dental profession, has seen fluoride or fluoridation as a sense of pride in this thing. It's been a source of huge amount of funding. The dental research profession was literally built on the backs of the fluoridation program. The researchers that researched fluoridation in the 40s went on to become the head of a new agency called the National Institute for Dental Research. And it was at a time when this practice actually sort of brought dentistry into the medical profession. It brought it onto a level playing field, which meant they could get a lot of money for research from the government and so on, and respectability and pride, and people have made whole careers out of extolling the virtues of this thing, and it's very difficult to turn around and say we were wrong, that this was a bad idea. For most dentists and doctors, it's all they only get one side at dental school, that it's safe and effective and that people opposed to it are Looney Tunes at dental school. And then when they've graduated, most are extremely busy treating patients. They don't have time to read this literature. And then if you go into the middle levels of bureaucracy, they quickly learn that you don't question policy. Someone who questions policy is a troublemaker, and you're not going to get promoted and so on. So if you're within the bureaucracy, either the dental profession or the public health people in state health departments and the federal bureaucracy and so on, you don't question. So you're left with a handful of people at the very top, and their motivations are difficult to unravel. It's pure conjecture on my part, but my feeling, this is after 16 years of struggling with this question, why? Why do you continue to do this, even though the evidence that you're causing harm is there, the evidence that you're reducing tooth decay is very, very weak indeed. Why are they continuing to do it? Why are they pushing even harder? Why right now are 3 people about to vote in fluoridation in Portland, Oregon? Why are they refusing to debate the issue? Why are they refusing to let the citizens vote on it? 3 times the citizens have voted in Portland against this thing, but no, there's something out there that is determined to push this into every last non-fluoridated city that they can. And I say, why? Why? The only thing I can come up with is that I think this is the calculation. If they lose fluoridation, they lose credibility. If they lose credibility, I'm talking about the public health community now, then it threatens other public health practices. For public health, you have to have the public's trust, and they're scared stiff of losing that public's trust, and therefore they've got to keep denying that they're damaging health or doing anything wrong with fluoridation. So I think it's more or less they're defending fluoridation with so much frenzy, because if they weren't defending fluoridation, they might be defending some other things like vaccination and some other public health practices, which I think is much more dear to them at the center, the US Surgeon General and the other people in NIH. I think these are more important public health practices, but they feel that they don't want to protect those naked. They want the skirmish to be on fluoridation. I don't know. If anybody that watches this has any other ideas why they think this is going on, who's making money out of it. We know the phosphate fertilizer industry is making money. We know the sugar lobby has always been pro-fluoridation because it's a distraction from one of the real causes of tooth decay is too much sugar.
Sure.
So as long as you have the magic bullet of fluoride, you don't have to worry about whether your kids are eating too much candy, drinking too much soda, chocolates, cookies, and so on. We have possibly the dental products people are worried that if fluoridation goes, then they could take a hit too. If we establish that fluoride is causing, say, osteoarthritis, if it's causing, well, we know it's causing dental fluorosis, if it's causing osteosarcoma, then they could be in trouble with lawsuits, and they have deep pockets, and they know that. And then if you want to be cynical about it, the people that sell bottled water, maybe they have an interest in keeping fluoridation going, because all the time you're putting poison, which is what it is, in the public drinking water, then you're going to be able to sell your bottled water to those people when they learn about it. And maybe, and this is being really cynical, that maybe the pharmaceutical industry is only too happy to see us sick. Because if it's true that fluoride contributes to arthritis, then that's a big medication there. Painkillers are big. If it's contributing to gastrointestinal problems, another big thing, all those things that you take for indigestion and diarrhea and constipation and headaches and stuff like that. So there's a lot of, there are people out there that are pretty convinced that they are sensitive to fluoride. And they have these symptoms. And they usually don't know about it until they go to the doctor with these symptoms, common symptoms. They go to the doctor and they start getting treatment. Nothing works. Nothing works. This goes on for several years. And they're buying all kinds of medications. And then they say to somebody says to them, is your water fluoridated? I don't know. Well, try not drinking the tap water. And mysteriously, these symptoms disappear. And then after a few months, they come back again. And then they say, what happened? And they find out they got fluoride from somewhere. So, so there is money being made out of there from some of the ailments caused by fluoride. And there's certainly some economic interest.